systems. India has laid a strong foundation in its digital public infrastructure journey. Today, we take the next step towards the intelligent, evidence-based and impactful use of artificial intelligence in healthcare. To formally welcome us and set the context for today's launch, I invite Shri Kiran Gopal Vaska, Joint Secretary and Mission Director, Ayushman Bharat.
Thank you, Yukti. A very good afternoon to everyone. Chief guest of today's event, Shri J.P. Nadda ji, Honorable Union Minister for Health and Family Welfare, Chemicals and Fertilizers, Secretary Health, Government of India, Punya Salila Srivastava ma'am, CEO NHA, Shri Ashok Barnwal, OIC, the World Bank CRO Office, Director IIT Kanpur. It's a privilege and an honor to welcome all of you to this event where we launch two of the most important initiatives in healthcare for India. The strategy for healthcare in AI for healthcare in India and the benchmarking platform. At the very outset, I'd like to express our sincere gratitude to Honorable Union Minister for his leadership and steadfast commitment to digital transformation in healthcare. Under his guidance, India has moved decisively towards building a modern technology-enabled health system. History shows us that certain technologies redefine societies. Electricity did that. Internet also did that. Today, artificial intelligence stands as the next general purpose technology. One that will influence diagnosis, treatment, pathways, hospital management, public health surveillance, research, and policy decisions. But history also teaches us something else. Those who succeeded in a technological revolution are not merely those who build the sophisticated tools. They are those who implement them effectively, at scale, and with responsibility. In healthcare, this principle becomes even more critical, and the real measure of success will not be the best model in a laboratory, but the most trusted, safe, and impactful system deployed across districts, states, and communities. India is unique and through interoperable records, consent-based architecture, and a federated method of storing data that have laid the rails for responsible AI adoption. ABDM is not just a digital platform, but it is the foundation upon which intelligent learning health systems can be built. Today, in this event, we will be releasing the strategy for artificial intelligence in healthcare for India in the august presence of the Honorable Minister, which is an important milestone in our journey alongside a benchmarking platform for AI solutions in healthcare. Together, they reflect our commitment to ensure that AI in healthcare remains safe, ethical, evidence-based, and aligned with public health priorities. AI must augment human judgment, expand access, reduce inequities, and strengthen system resilience. At the same time, innovation must also be accompanied by transparency so that clinicians and health administrators can rely on validated, high-quality systems, and adoption is guided by evidence rather than hype. Friends, AI offers us the opportunity to enhance the productivity of our health workforce and improve disease detection. And for a country of India's scale and diversity, such capabilities are transformative. This collaborative effort, both the strategy and the platform, have been done through a rigorous effort involving experts across disciplines and institutions. And having had the privilege of being part of this process, I can personally attest to the depth of deliberation and commitment that went into shaping this document. This work reflects both intellectual rigor and a deep sense of public responsibility. Let us today mark not just the launch of a document and a platform, but the beginning of a sustained national mission to make AI work for India's health system and for every citizen it serves. With that, I welcome you all once again for this very, very important event, and thank you, and a very good afternoon to all of you.
Thank you, sir, for setting the context. To take us through the vision and roadmap of strategy for artificial intelligence for healthcare for India and tell us in detail about both the benchmarking platform, it is my honor to invite and welcome Dr. Sunil Kumar Bandwal, Chief Executive Officer, National Health Authority, on stage. Sir, may I request you to kindly address the gathering, sir.
Honorable Union Minister of Health and Family Welfare, respected Shri J.P. Nadda ji, Honorable Secretary, Department of Health and Family Welfare, Srimati Punya Salila Srivastav ji, Dr. Catherine, Officer in charge of WHO, Dr. Manindra Agarwal, Director of IIT Kanpur. Indeed, privilege for me to be present before you to present about the two important milestones which is being launched today in presence of Honorable Minister. And in these two launch, I stand before you in two capacity. One, as chairman of the committee which was interested to draft this strategy for AI in healthcare for India. And second, as CEO of NHA, which signed a MOU with IIT Kanpur in April 2024 to develop an open benchmarking platform for AI solutions. And these two are now being launched. It's indeed a very important day for Ministry of Health and Family Welfare in the journey of AI in healthcare. So I'll just in nutshell present what exactly this strategy will entail and how does it guide us for deploying AI at population scale in transforming healthcare delivery in India, and how this open benchmarking platform actually build trust for AI solutions for deploying in Indian context. So I must So the idea of having a strategy, which we are calling it SAHI because a strategy for AI in healthcare for India, it really suits us. In a way, it will correct most of the things which we have in mind and the concerns which are being raised around the artificial intelligence. The idea came, why should we have a separate sectoral strategy for AI, for healthcare? See, there is already a national strategy for AI, which is sector agnostic. But if you see application of AI in healthcare, it has a unique concerns, lot of sensitivity, several ethical and safety considerations, which needs to be addressed before applying AI in healthcare. At the same time, we need AI to improve the workflow of healthcare delivery. And therefore, it has to move from experimentation to systematic, safe, and scalable implementation. So we want AI, but at the same time, we also need to create the guardrails within which it will be applied. And therefore, having a separate strategy for AI in healthcare was required to be put in place, and Honorable Minister, under his leadership, Ministry of Health and Family Welfare decided to have a separate strategy for AI in healthcare, and today is the day which we will be launching it. So, if we go in the background, there has been large deliberations which took place before coming up with this document. And it involved deliberations with clinicians, health tech companies, participants of the healthcare deliveries, governments, more particularly the state governments, policy makers, and it was held at several levels. There were 4 major workshops across the country, starting from Vijayawada to Delhi to Shillong, and ultimately also in IIT Bombay. The aim was to involve everyone who is affected or who could contribute in development of this document. And it was tried in a great details. In fact, some of the workshops which I attended, I saw sentence by sentence, word by word of this document was deliberated. And everybody was asked if you have some input or can it be made better. And that is how this document has come up. And I believe it gives good guidelines for us to actually deploy AI solutions in healthcare with all caution which concerns us. So I'll just read out the vision which has come out for this strategy. It is to enable the safe, ethical, evidence-based, and inclusive use of artificial intelligence across India's healthcare system, leveraging digital public infrastructure and institutional strength to drive responsible innovation, expand access to high-quality, affordable care, improve health outcomes, and position India as a global leader in responsible AI for healthcare. So primarily, it aims to cover everybody's concern, at the same time promote innovation and expand access to high-quality, affordable care, which is ultimately the objective of all of us. So with these, if we see, we have aligned with some of the basic 7 principles which MeitY has set for AI governance guidelines, and these are applicable also in healthcare. And these are, trust is the foundation, which we all appreciate. Person is in the center. So the patient will be in the center, people will be in the center. Innovation over restraint. So while we raise all kinds of concern, but we cannot stop innovation. We cannot stop deployment. We have to find a way how to deploy AI solutions. Then fairness and equity, accountability. Whatever solution we apply, we must find out if it goes wrong, what are the accountability metrics. Then understandable by design, and finally the safety, resilience, and sustainability. So finally, the document has come up with 5 pillars, and each pillar had some themes under which the recommendations have come. So finally, these recommendations will be the guiding guardrails for us, as well as promoting innovation for application of AI in healthcare. So first is the governance, regulation, and trust, which we all realize in case of healthcare, it is the most important one. We must have some regulation which ensures the trustworthiness of the AI solutions, which factors the risk and safety of the patient, ensures transparency and accountability, and it coordinates with other sectors too. Second is the health and data digital infrastructure. We all know AI works on data. We have created the digital foundation. We need to generate quality data. So it talks about the data quality, data integrity, and data life cycle governance. Similarly, the workforce, institutional capacity, and change management, which is another very important thing which we have realized with every technology. though the technology could be very good, but unless it is actually the change management or the capacity building is done properly, it may not yield the right result. And therefore, we will have to build the capacity, both institutional as well as individual, and do the change management to ensure right usage of the AI solution. Then research, innovation, and evidence generation, which is talking of a larger ecosystem, and finally developing a ecosystem for AI deployment at population scale, which will lead India, actually make India or position India to lead in the global south for application of AI solutions in healthcare. With these, we are expecting that the strategy will actually have a outcome and impact by generating public value-driven AI adoption, a stronger health system performance, quality, safety, and governance, equity and inclusive impact, responsible innovation ecosystem, continuous learning health systems, and finally, trust, transparency, and ethical alignment. So these are some of the features. Details will be available after the launch on the website, and people can go through it. Soon thereafter, there will be many other discussions for implementation and taking it forward. Now we'll come to the next project, which is benchmarking open data platform. Here, the objective is just twofold: enable AI models providers to benchmark their models on real-world healthcare data. Every time we are talking, there are AI models, but are they trained on Indian data? Are they trained on diverse data in Indian context? If they are trained on foreign data, is it good to use it in Indian context? So this is addressed by benchmarking against this open benchmarking platform, the AI solutions which is brought for implementation in Indian context. And then provide trustworthy third-party evaluation. See, every AI solution provider comes with a clear saying that it has 99% efficacy, 98% efficacy. How do you know that it has that? Unless you test on real patient. Do you want to test a solution which has not been proved on a real patient? Or do you want to benchmark it beforehand and then apply on a real life? And that is what this platform will do as a third-party evaluation. It finally actually addresses the trilemma of any AI solution vis-a-vis its coverage, reliability, and openness. Most of the time, AI solutions comply with two of these issues, but ultimately, once it is tested, benchmarked against this platform, then only we can be sure of all three. With these, I close the presentation and wish that these two launches which is happening today will create huge value for AI in healthcare delivery and create a pathway for healthcare delivery transformation. Thank you very much.
Thank you, sir, for setting a clear collective direction for us all and sharing such a comprehensive overview. Scientific rigor and validation are central to trustworthy AI. I welcome and invite Professor Manindra Agarwal, Director, IIT Kanpur, to share his remarks on the benchmarking platform. Sir, the floor is yours.
Dr. J.P. Nadda, Minister of Health, Ms. Punya Srivastava, Secretary Health, Ms. Catherine Bhome from WHO, CEO NHA, Shri Barnwalji, all the distinguished guests here. It's a pleasure to be here in front of you and share some thoughts about the BODH platform developed by Professor Nishit Srivastava and his team at IIT Kanpur. The key challenge this team faced, which is somewhat unique to the healthcare, is that the real data on which any AI model needs to be trained is very fragmented, is available with various health centers, hospitals in small amount. It needs to be protected well because there are privacy issues. So the sharing form to aggregate, but the moment you bring them on a single platform, every model developer who wishes to train it starts, the data after some time doesn't add any value because it's the same data. So one needs a mechanism to ensure that this data is constantly updated, and there needs to be an incentive mechanism to motivate all the data holders to upload their data. And that's the key challenge that our team has solved and has created a platform which will, it's a federated platform which will collect data, keep it secure. Any AI, any model developer can upload, send their model to be trained on site on the data available. So the model developer will not get access to the data. They can train their model and get the trained model weights back. And those who hold the data, new data, they will are incentivized to upload the data because then they can get credit and use it further. So we hope that with this model being put in place, it will create a major change in the development of AI models in healthcare on Indian data for the use of Indian patients. And we hope that this will make a significant impact in the overall healthcare scenario of the country. With that hope, I thank you again for joining us and having me over here. Thank you.
Thank you, Professor. We are honored to have with us Dr. Katharina, Officer in Charge, WHO Southeast Asia Regional Office. Ma'am, may I kindly request you to share your remarks?
Honorable Minister Shri Nadda ji, dignitaries on the dais, excellencies, partners, colleagues, and friends. In a previous session, someone predicted that in no area other than healthcare, AI will save so many lives when used successfully and responsibly. But it also comes with risks. Therefore, today marks an important milestone in India's digital health journey. With the launch of the strategy for AI in healthcare, India is charting a clear path for how AI will serve public health. Not ad hoc, not as a series of pilots, but as a system tool, responsibly, safely, and most importantly, at scale. AI is already today very much influencing how health systems operate. When you think of improving screening and diagnosis, when you think of strengthening surveillance, accelerating research, and supporting more efficient service delivery. So the question before us is clearly no longer whether AI will shape health systems, but much more how it will be governed, how we implement it most successfully, and how we align it with our public health priorities. India's strategy answers that question with clarity. As the first country in the WHO Southeast Asia region to adopt a comprehensive national AI strategy for health, and one of the first countries globally to have such a strategy, India has set a benchmark. This is not simply a technology roadmap. It's a public health strategy built to strengthen care, improve decisions, and extend reach. SAHI is anchored in India's broader digital health agenda, as had been said. It supports progress towards UHC and our Sustainable Development Goals. And it reflects a very simple principle. Innovation must strengthen systems, expand access, and build trust. On the defining strength of SAHI, as has been said, is how it was built. Through consultations across North, South, East, and West India, the strategy was shaped by central ministries, state governments, regulators, academia, industry, startups, clinicians, civil society, and development partners. And I thank all of you who have contributed to this effort. This whole of government and whole of society approach ensures SAHI reflects India's diversity and the realities of implementation on the ground. The result is a framework that hopefully will be practical and action-oriented. It sets out what is needed to move from potential and from promise to actual impact. Governance and oversight, quality data, and interoperability, secure infrastructure, and workforce readiness. In short, it sets out the rules, the rails, and the readiness to deliver. The real work, though, now lies in its implementation. Turning strategy into measurable health gains will require sustained commitment, regulatory clarity, institutional capacity, and continuous learning. It will also require partnership and investment in people, because AI will only strengthen health systems if health workers and managers are trained, supported, and confident in using it. WHO has been privileged to support the Government of India in the development of this strategy through our regional office and our India country office. We remain committed, very much committed, to the next phase, supporting the operational planning, strengthening governance mechanisms and standards, supporting workforce training and capacity building, and making available and strengthening our networks for the exchange of knowledge and best practices all over the world. India has shown that AI in health can be guided by public health values, shaped through inclusive consultation and aligned with national priorities. We commend the Government of India, in particular Honorable Minister Nadda, for his leadership, for your leadership, and we thank all partners who contributed to this important achievement. This strategy will give India a strong foundation for the next phase of its digital health journey. So let us move forward together to ensure that AI serves what matters most, helping a health worker make a better decision, save time, be efficient, and save his patients or her patients, helping a patient get the right care sooner, and helping health systems reach those who are still being left behind, while building and sustaining, importantly, public trust. In doing so, we will strengthen health systems, expand equity, and accelerate progress towards universal health coverage and health for all. I thank you.
Thank you, ma'am, for your wonderful remarks. The responsible adoption of AI requires institutional clarity, life cycle oversight, and structured national direction. It is now my privilege to invite and welcome Ms. Punya Srivastava, Secretary, Ministry of Health and Family Welfare, to deliver the keynote address. Ma'am, we look forward to your address.
Honorable Union Health Minister Shri Jagat Prakash Nadda ji, CONHA, Director IIT Kanpur, Dr. Katerina and Kiran. It is distinguished delegates, colleagues from government, industry, academia, WHO. It is a proud moment, I think, for all of us. us to be a part of this prestigious event. Under the visionary leadership of our Prime Minister, Shri Narendra Modi ji, we have made tremendous strides in leveraging technology for making governance inclusive and efficient. And this summit has indeed come at a crucial time as AI has advanced rapidly in recent years. And over the past decade, India's health system has also seen a major digital transformation. Yesterday, we had a very vibrant discussion about how the National Digital Health Blueprint laid the foundation by promoting open standards, interoperability, and the use of Gen AI. Then came the ABTM, the Ayushman Bharat Digital Health Mission, which further strengthened this ecosystem through interoperable digital infrastructure and integrated data systems. We are already integrating AI into our public health systems. So we discuss how it is helping us in tuberculosis risk prediction. We have used AI to map all our vulnerable spots in the country. We are using it in diabetic retinopathy screening, in assisting the telemedicine consultations, and of course in outbreak surveillance. So today's launch of Strategy for AI in Healthcare for India, SAHI, and BODH, the benchmarking open data platform in health AI, marks an important step in advancement of AI in healthcare. And I thank all the stakeholders, WHO, and of course my colleagues in NHA and ICMR, and all the other stakeholders who have made this possible.